Okay, clinic is over, so time to go home and your work is done, right? No. Unfortunately, as you probably know, a large part of being a primary care physician is the work that we do in between the visits. So let me show you a couple helpful tips that will hopefully organize your workflow in between seeing patients and after hours so that you're being most efficient. So what I use as my sort of running list of outstanding issues is the notifications tab, which is when you initially log on to CPRS. I'm not going to show you because I have patient protected information there, but you would go to File, select New Patient, and that would bring you up to the main screen with the notification tab. So on the notification tab, a number of things are going to come there. Um, all of your unsigned notes are going to remain on your notification tab. All of the labs that you order, all of your imaging, all of your initial consults when they are completed will show up there. All any procedures that you order will show up there. If you set your notification tab correctly, when your patients get admitted to the hospital, you'll get a notification of that. And then finally, we'll talk about at the end of this is setting a self alert for yourself. Those will show up on your notification tab. So, what I do is I really keep that as my running list of things to do. Certain things on your notification tab, you'll notice that if you click on them, they will go away. That includes labs, imaging, results of referrals as well as procedures. So what I do for that is I will manually go into the chart by clicking the first letter of their last name and their last four, and I'll review their labs. Only once I've addressed the labs and done what I'm going to do, which is either a letter or a phone call, then I will click off on the lab. So I use it as my list of things to do. If you get an alert from a nurse or another doctor for a co-signature, you can click on those alerts. Those won't go away. And so you'll sort of get the hang of it. But that's basically how I use the notification tab. Let me show you how to set up your notification settings so that you're only getting notifications that you want to and using it most efficiently. So again, you're going to go to Tools, you're going to go to Options, and you're going to go to Notifications. So some of the notifications are mandatory, so you can't click off on those. But let me show you the ones that I recommend that you have and don't have. So I recommend that you don't have abnormal lab results because if you have abnormal lab results, they will basically be duplicates along with your normal lab results. So if you have normal lab results clicked off, that will give you all of them. So I encourage you to have those unclicked. I would like you to have admission so that you know when a patient is admitted. Anatomic pathology is mandatory. Appointment request canceled. I would recommend having that on. These two are mandatory. Consult request updated. I strongly recommend that you have this turned off. So when you place a consult, the MSA, the secretary, is going to be calling the patient. There's going to be a lot of noise on the consult, and if you do not have this clicked off, you're basically going to get a notification every time the secretary tries to reach out to the patient. So you'll get a notification. Tried to call the patient, couldn't reach him. Tried him a second time, couldn't reach him. It's going to add to your workload and it's going to add to burnout. And so that's why a few years ago this was turned off. So very, very strongly encourage you to have that turned off. Critical lab results, obviously mandatory. The next set of things you want to have on is flagged order for clarification. So the pharmacist can flag a medication to let you know that there's something wrong with the way you ordered it, and then flagged OI orders. I want you to have all of those turned on. The reason why, as I'll show you in a second, that this allows you to get self alerts. Uh, this is mandatory. Imaging requests cancel or held. Imaging results amended. That's also mandatory. Definitely want you to have clicked off imaging results non-critical. If you don't have this clicked off, you're only going to get abnormal imaging, not normal. And obviously you want to get both normal and abnormal. Lab results, you definitely want to have that clicked off. Again, if you don't have this clicked off, you're only going to get abnormal labs and then your normal labs will not result to you. So definitely have that clicked. You do want to get your mammograms, obviously. Orders requiring chart signature, co-signature, electronic signature, those should all be clicked off. order flag, that's mandatory. And that is it. So basically, I want you to have your notification tab set up exactly like that. And then you would click OK, and that will save your settings. The other way that I keep myself organized is a new function, which sounds interesting considering CPRS is so old, but a new function which is called Future Self Alerts. And so this allows you to get reminders about your patients in between their visits. So let's say, for instance, my patient, his TSH is elevated, and I want to increase his synthroid, and I want to have him come back in 6 to 8 weeks to do a lab. So you can certainly tell the patient to do that, but you may have some patients who are not great at remembering these things, and so it's more beneficial if you call them when it's time for them to do the lab. So what you could do is you could click on Future Self Alerts, and you can click any of these, doesn't really matter. For this situation, I'm going to do lab, and I'm going to do a 6 week reminder. So it's going to do T plus 6 weeks, and I'm going to say call patient to remind them to get TSH done. Of course, your nurse can obviously do this, but you can set a reminder for yourself, and then you can tag your nurse. So you hit accept order, and then you would go ahead and sign the order. And basically, in 6 weeks, the notification will come to you that the patient needs a repeat TSH. I often do this when they need, a follow-up X-ray after having pneumonia, if they need any sort of repeat labs, or perhaps if I have something that I want to call, I want to check, they have an acute illness and I want to check up with them in a few weeks, I may set myself a self-alert reminder. The important thing to know is that you will get an alert 1 business day before the date that you set it. So here the stop date is September 18th. So I'm not sure what day of the week that is. Let's see. So September 18th is a Friday. So on Thursday, a notification will pop up to remind the patient to get their TSH. And I think this is a nice way to keep yourself organized. It keeps everything within CPRS. And so that is briefly how I help to stay organized and manage my alerts and workload in between seeing patients.